Assalamu alaikum. Hello. Good afternoon. Happy New Year. We are glad we survived 2024. We are also hoping for surviving 2025 also with good health. Yeah, welcome back to our usual online lecture presentation. In my last discussion with you, I mentioned that we shall be discussing disaster distribution according to regions in Nigeria, and that will come along with effects of disasters. But for now, I'm going to skip that for now, and I'm going to jump into Unit 2 of this aspect of the emergency and life and disaster nursing. So I'm going to go to Unit 2 now, and the title of Unit 2 is Emergencies and Life-Threatening Situations. Emergency and life-threatening situations. And I keep telling students in your class, in your type of class, and also in other basic programs, that whether you like it or not, as long as you want to remain in this our profession, disasters will occur and you'll be faced with emergencies. And it's just better for you to be prepared for them, because they will come. If they don't come this month, they don't come this few months, they will come next year, or as long as you continue to remain here, they will come. There's no way you're going to run away from them. So, emergencies and life-threatening situations. Emergencies, as I said, disaster brings emergencies. So, emergencies are classified. It can be medical emergencies, they can be respiratory emergencies, which is under medical emergencies. They can be respiratory emergencies, they can be cardiac emergencies, they can be trauma emergencies, they can be neurological emergencies, they can be pediatric emergencies, and these are the areas we are going to talk on in the next few minutes. So let us start with medical emergencies. And I said one of the medical emergencies is what we call cardiac emergencies. And cardiac emergencies include heart attack and cardiac arrest. Heart attack and cardiac arrest. Of course, cardiac arrest means it is mentioned, arrest of the cardiac functions, stoppage of cardiac functions. And what are cardiac functions? Pumping blood, receiving blood, and pumping the blood out. If it stays still without doing its function of relaxation and contraction, there will be no pumping of blood out of the heart, and there will be no reception of blood from outside the heart. Of course, outside, I mean from the body into the body. Those are the functions of the heart. Blood into the body, receiving blood from the body. So when these occur, when there's heart attack or cardiac arrest, we have what we call medical emergencies. And these emergencies, you have to intervene immediately. If not, there will be loss of life. Under medical emergencies, we have respiratory emergencies. Asthma, respiratory failure, COPD. These are some of the respiratory emergencies we have. Asthma, you know. Asthma requires immediate intervention. respiratory failure because of a problem in the respiratory system. The respiratory system will fail. The lungs will fail to do their functions of inspiration and expiration. And when the body cannot receive oxygen, especially the brain, if the brain cannot receive oxygen in 3 to 5 minutes, there's likely going to be loss of life. Because that heart that you see also requires oxygen to function. If the lungs cannot supply the oxygen to the brain and the heart, there will be problem. Another medical emergency is what we call trauma emergencies. This is mentioned, trauma emergency is mentioned here because that trauma can affect the lungs, chest injury, brain injury, that can lead to severe injuries of those areas or severe bleeding. And when there's severe bleeding, body losing a lot of blood, and remember, body requires a lot of blood. If a lot is lost, there won't be enough for body functions. And so we call this one trauma emergencies, which will require medical intervention in terms of blood supply. All right. Another medical emergency is neurological emergencies. And under these neurological emergencies, you have stroke, we have seizures. A stroke, of course, means inability of the brain tissues to receive blood. And that inability can come from either blockage or bleeding cerebral blood vessels, bleeding cerebral arterioles or arteries. When they bleed and they are not supposed to bleed, when they are blocked and they are not supposed to be blocked, there will be no blood supply, there will be no oxygen, there will be no nutrients to the brain cells. And the brain cannot handle that more than 5 minutes. There will be problem. Seizures, of course. Seizures means the brain doing excessive work. If it is doing excessive work of sending messages, the brain, the heart cannot get its normal nerve supply in terms of functions now. The impulse coming from the brain to make the heart to be beating or the impulse going to other important body organs, the heart, there will be a neurological emergency. The emergency, in this sense, you have to intervene immediately. And of course, the last one under this medical emergency is what we call pediatric emergencies. Emergencies that have to do with children. Even though it does not have to do with blood supply, but it can cause problem for the patient. Under pediatric emergencies, we have child abuse, pediatric trauma. In this aspect, there's something that can happen to an adult can happen to a child. And poisoning, because poisoning is very frequent among children because they don't know. 1 year old, 2 year old, 3 year old can see poison, take it. And that is why they keep saying, keep out of reach of children in some drugs, because they can take them and they will cause poisoning that can lead to loss of life, that can lead to chemical disturbances in the body of the child, chemical disturbances that can reach the blood vessel, the circulatory system, and cause problems for the patient. Chemicals that can reach the lungs and cause problems for the child in terms of respiratory function. Another classification of emergencies is what we call number 2 now, is injury-related emergencies. Remember, the first one is the medical emergencies, the second one is injury-related emergencies. Even though there are emergencies in the medical emergencies that are injury-related, but here the issue of surgery will not come in here. For injury-related emergencies, so emergencies due to injuries that occur. These injuries can come from disasters. One of the injury-related emergencies is head injuries. Under this head injury will be skull fracture or concussion, hitting your head somewhere on the third rod, hitting your head in different areas of the environment can cause concussion, and concussion means the head will be jarred, the brain will be shifted, it will be moved because of the heavy impact. Or when there's skull fracture, there will be fracture of the skull with the brain under the skull. Fracture of the skull can lead to injury to the brain. That is also an emergency. Under injury-related emergency, we have what we call B, spinal cord injury. You know where spinal cord is? The brain in the skull narrows down, and in the neck, the spinal cord begins. So injury in the vertebral column, okay, from the neck down to the waist, can lead to paralysis, can lead to spinal cord shock, can lead to fractures. So there can be fracture in the spinal cord, in the spinal column now, that will affect the spinal cord. That can lead to paralysis, that can lead to shock. Another injury-related emergency has to do with burns, fire in the house, fire in the vehicle, fire in the office, fire in the marketplace. All these areas can cause injury. And burn injuries can come from fire, as I said, which is we call it thermal injury. It can come from electrical shock causing burns. It can come from chemical injury causing burns. All these are emergencies that can happen as long as you are in our profession. And they occur. That is why they are studied, because they know they occur. So they are studied and solutions are found to when they occur. Another emergency that we have is the one we call environmental emergency. Remember medical emergency, remember injury-related emergency, and now we are talking about environmental emergencies. My children, my sisters, probably my grandchildren, I'm not talking to you, they occur. You hear stories, or you may have witnessed. So under environmental emergencies, one is what we have what you call drowning. Drowning in the rivers. Canoes will capsize, turning human beings into water. Those who cannot swim will drown. Those who can swim get drowned. They can get drowned because of heavy materials, okay, trapping them under the water. Or there is what we call near drowning. And under drowning, we have near drowning or drowning. When a person drowns, we're talking about leading to death or almost leading to death. Near drowning is closer to it. So intervention will have to come, okay, when these emergencies occur. Under environmental emergencies, also we have weather. Weather can cause environmental emergencies. We mentioned some of those before. Tornadoes, we don't have them here. Those are heavy winds with rainfall moving at hundreds of kilometers speed, bringing down anything on its path. Buildings, vehicles, whatever will be brought down by heavy wind during rains. We call that tornado. Hurricanes are also there. Wind, heavy wind. And of course, flooding. All this can cause emergencies. And these emergencies, in the end, affects human beings, because human beings are in the environment. And also animals also get involved. But remember, it's not only human medicine we have. We also have animal medicine. Veterinarians also do this, use this in caring for animals also. We have another emergency we call psychiatric emergencies. Under psychiatric emergencies, we have a suicide ideation. We'll continue using terms for you to know. When we talk about suicide ideation, ideas of suicide. So the patients will have idea in their mind of wanting to end their lives because of one problem or another. And suicide ideations follow what we call suicide thoughts because of problems you have, marriage problems, financial problems, educational problems, all will weigh on you psychologically. You think they should not happen to you, and when they happen, ideas start coming into your mind and saying, why don't I just end my life? We are supposed to be able to find out, to see patients that could have these ideas and intervene. Under psychiatric emergencies, we also have what we call substance abuse, drug overdose, withdrawal from drug abuse, from dependence. All these are things that cause psychiatric emergencies, and they require intervention. Intervention must also be a quick intervention so that it doesn't lead to death. Another emergency is what we call hematological emergencies. Let us recap the emergency we've discussed. We've discussed medical emergencies. We've discussed injury-related emergencies. Okay, we have discussed environmental emergencies. We have discussed psychiatric emergencies, and now the last aspect I want to talk about under emergencies is what we call hematological emergencies. Hemato, hema, blood, logical, study of blood in terms of emergencies. And emergencies in hematology, in hema, in blood, has to do with one, bleeding disorders. Bleeding disorders. And bleeding disorders usually have to do with hematological malignancies. Hematological malignancies, malignancies that have to do with blood. And the one that comes to mind immediately is what we call leukemia. And leukemia means cancer of the blood cells. We know the importance of our blood cells, of carrying oxygen and nutrients. But for the blood cells to be able to do that, they have to be matured to carry oxygen, they have to be matured to carry nutrients. And emergency, cancer, you have to know what they mean. I probably may have discussed that here before. Cancer has three different features. Cancer is whatever area of your body has three different features. There are three things that, okay, make a body part to become cancerous. Or cancer actually means three things. Because our bodies have to do with cells, whether it is brain cell, whether it is muscle cell, whether it is bone cells. Nature has made our cells to be able to mature. It has to be matured to do its functions in whichever area it is. The cells in the blood will have to be matured to carry oxygen, to carry nutrients. The respiratory cells have to be matured to carry oxygen. The digestive cells have to be matured to break down food nutrients. So cancer means immaturity of cells of the body, or whichever part of the body, proliferation of body cells. Body cells they grow in number at a certain level. When they reach a certain level, they stop growing. They stop multiplication. They stop becoming too much. When they are getting too much, they stop their production. Cancer cells do not have that quality. Cancer cells continue to grow without any inner information to stop. And the third aspect of cancer is growth. The growth cells, cancer cells continue to grow without stopping. If there was no information for the brain to stop growing in size, do you know how our brain will look like? For the number of years we spend, it will be very large. So qualities of cancer is that there is immaturity of cells, there's proliferation of cells, and there's overgrowth of cells. And when this occurs in any body part, okay, there will be problem. And that is why people fear the moment they hear cancer, they fear it. Because cancer is the new field in cancer now is improving things. All right. So bleeding disorder, including hematological emergencies and bleeding disorders. Under bleeding disorders in terms of emergency is what we call allergical emergencies, meaning allergic reaction. There are different allergic reactions that occur that can affect your blood. And there's endocrine emergencies under hematological. So that is why you have thyroid storm, thyrotoxicosis, ketoacidosis in diabetes. All these cause hematological emergencies. We have a lot of work to do. Unit 2 is just not much. We'll enter Unit 3, but I will not go to Unit 3 now. But I'm going to do, remember I told you that under Unit 1, there's an area that we have not discussed with you, and I said disaster distribution according to regions and effects of disasters. I'm taking end of Unit 1 now, and I'm going to discuss effects of disaster. Okay, but remember Unit 2 is having to do with emergencies and life-threatening situations that I've discussed. Okay, and there are numerous that I've discussed under medical emergency, under respiratory emergency, under trauma emergencies, under neurological emergencies, pediatric emergencies, injury-related emergencies that are plenty that have discussed in terms of head injuries, spinal cord injuries, burns, and then environmental emergencies that are also discussed that include drowning, okay, weather emergencies, hurricane, flooding, all these are under environmental emergencies. And then we have psychiatric emergencies, suicide, substance abuse, and then the hematological emergencies that have to do with bleeding disorders, okay, endocrine emergencies. All these are things that are under emergencies, emergencies and life-threatening situations. So now, those aspects that I've not discussed, I'm going to discuss one, and I'm going to postpone the next one to the next class. I'll discuss the next one beside what I'm going to talk about now before we go into Unit 3. So at the end of Unit 1 that I want to discuss, I have not discussed, is effects of disasters. Effects of disasters. Disaster effects are these. When disasters occur, there is loss of life. When disasters occur, there could be injury and other health impacts. When disasters occur, there can be property damage. buildings in the marketplace, heavy wind, heavy rain, fire disasters, all can result to property damage. Loss of livelihood and services. Markets, areas, offices, companies, when disaster occur, individuals lose losses of livelihood. Marketers, businessmen lose a lot of things during emergencies, during disasters, and they will have to start all over again. There will be social and economic disruption. Schools will have to stop. There can be fire in schools, damaging rooms. So there will be social and economical disruptions. And lastly, environmental damage. Environmental damage. Damage to the environment. Farmers will lose a lot of food products. Fishermen will lose a lot of livelihood, because when flooding occurs, it stops them from going to fishing for a number of days. So those are some of the things that happen, and they become effects of disasters. And my sisters, they occur. They occur. They occur. What I'll do now is the disaster distribution according to regions will be discussed in the next class before I go into Unit 3. And the Unit 3 has to do with several things. Unit 3 is fairly large. It's fairly large, and it begins with the management of emergencies using basic life savings and support aids. And this is where a lot of things will come for discussion. And until that time comes, oh, excuse me, I'm a human being too, so your teachers also yawn, just like you also do. So I think that is okay for today, and next week will be another online discussion period by the grace of God. Okay? So as we did last time, this material will be also uploaded for you as a form of handout. I'm sure your coordinator might have discussed that with you. If he has not, he will. Okay? So you enjoy yourselves, okay? Enjoy yourself, and I hope you are enjoying my interaction. Whether you are in the north, whether you are in Kaduna, you are in Minna, you are in Sokoto, you are in Kebbi, Abuja, or if you are in the west, Lagos, Ibadan, excuse me, Ife, my favorite area of the southwest. If you are in the southeast, few areas that I know, I hope you are all enjoying the interaction. Take care, okay? Bye-bye.
This is